Cook-Altman giving my speech for the informative speech. Today I'm going to give the speech on risk factors involving cardiac diseases. Recently, the third person in my family was diagnosed with chest pain and a form of cardiac disease. This event is something that is near and dear to my heart. It's one that I see daily. I work here in the emergency room and I've been in emergency medicine for 20 years now. Knowing the diseases and work that goes into staying healthy, a person needs to try to decrease the chance for risk factors. Today I'll provide the information needed to recognize uncontrolled risk factors, controlled risk factors, signs and symptoms of chest pain, and preventable measures for cardiac diseases. Let's begin with controlled and uncontrolled risk factors. Aaron Ammerman of Human A&P 2016 states that the risk factor is something that increases your likelihood of getting a disease and or a condition. Controlled risk factor is something that is influential or a lifestyle choice that can affect a person's health. A very good example of a controlled risk factor is tobacco use. Smoking and or chewing is a perfect example. Tobacco use, a smoker that is smoking on a normal basis has a 2 to 4 times the normal person's risk of sudden death, according to Samuel Gidding, MD. Along with tobacco use is hypertension. Hypertension is elevated blood pressure. It's a common risk factor, also known as a silent killer. Untreated with hypertension, you can have several diseases: kidney failure, heart failure, and normal blood pressure for an everyday person is 120/80. One of my teaching aid, or visual aids I should say, is a blood pressure cuff. I'm going to use Jenny. Very simple to do. The 120/80 is just a benchmark. It fluctuates person to person. The big thing is just getting it on proper placement in the arm, checking the dial, using a stethoscope, and getting your readings. Thank you, Jenny.
You're welcome. How are you?
Uncontrolled risk factors, obviously a person has no control over. A good example of an uncontrolled risk factor is age. Age is probably one of the highest risk factors. As you get older, obviously your risks go up. Another one is of an uncontrolled risk factor is hereditary. A person cannot help that. What you're born with obviously is what you get. You have to treat that as you get older, as the signs and symptoms develop. So from the risk factors, we're going to go into signs and symptoms of cardiac disease and or chest pain. According to Patricia Montrosh, critical care nursing of a holistic approach, states that chest pain is a primary disease with chest pain is a primary symptom. Angina is described as pain that is relieved or goes away with rest. Perfect example of this is when a person is out snow shoveling the driveway. They begin to have a sudden onset of chest pain. They go in, rest, the chest pain is relieved. That is described as angina. The opposite to angina is myocardial infarction. With that, it is considered dead or dying tissue and is described as the lack of oxygen to the tissue or the muscle. With this, obviously, it's the more critical of the two. The saying is time is tissue, and they need to be seen and or treated as soon as possible to help alleviate extensive further diseases and or death if it's not treated appropriately. With the signs and symptoms of angina and myocardial infarction, as discussed, we're going to talk about important preventative measures. Physical activity is a great preventable measure. Along with that is diet. So between the two, in today's day and age, another one of my aids is a Fitbit. With technology today, a person can track his or her activity steps during the day. There's also apps on the phone that counts the calories. So you can keep track, which is a great way, opposed to something that's like 50 years ago when a person just ate, did not have any idea where they were at in their normal daily exercise, diet, and routine. With the physical activity and the recommended diet, people also need to know about the excess weight. With excess weight, it increases the blood pressure, increases the risk factors, as mentioned earlier. With a controlled diet, you can control diabetes, obesity, and obviously overall fitness. With the cardiac risk factors discussed, as we just did a minute ago, there's certain things that a person can do. Today I've provided you with information about uncontrolled and controlled risk factors, signs and symptoms of the cardiac disease, prevention of the cardiac disease. With all of this mentioned, my family, as mentioned earlier I should say, it gives me pleasure that I can tell you that they were aware of the cardiac risk factors. It was recognized at an early time and possibly saved their life. It's my goal with this speech and the information that's been given that hopefully someone will be aware or can be aware, and that it can be recognized, the importance of cardiac diseases and the risk factors, and it can help save you and or your family members' lives. Thank you.